Welcome everyone to the third meeting in our 23-24 virtual meeting series. And as most of you know, the first four of the series are financial assistance programs available to the Fabry community. Tonight we have Jennifer Noonan with Accessia Health. Casey is going to tell you about Jennifer, and then Casey is going to handle the Q&As at the end of the session. And we'll also have the prize drawing later. Casey is a genetic counselor and the senior program manager for education and community support programs with the National Fabry Disease Foundation. Welcome, Casey.
I'm happy to be here tonight with Jennifer Noonan. Jennifer Noonan is a nurse with over 20 years of clinical experience before joining Accessia Health, where she is currently the Senior Director of Clinical Programs and Compliance. You may have been familiar with PSI or Patient Services Incorporated in the past, which became Accessia Health in 2022. Jennifer is here today to talk to us about financial assistance programs available to individuals with Fabry disease. Please welcome Jennifer, and feel free to put any questions you might have in the chat while we're talking, okay? Welcome, Jennifer.
Thank you so much, Casey. It's good to see you again and to be here tonight. I appreciate you all taking time out in the evening to meet and hear a little bit more about Accessia. So as you mentioned, Casey, I know that a lot of folks were familiar with our organization from a previous name, which was Patient Services, Inc., or PSI. So we're the same organization. We've just changed a lot of people that are there now. Our leadership team has changed quite a lot, but we also have some people that have been with the organization we have a few people in our patient services department that have been there for almost 30 years. So it's kind of interesting to be in an organization that has such longevity. So very mission oriented, working on just getting back to the basics and improving our access for patients, and additionally working towards just patient-centered outcomes. So we've recently also created a patient advisory committee. So we invited some patients and or caregivers who have dealt with chronic and rare disease to come to the table and help us make some decisions. So that's been fun to be a part of. But our biggest goal is to improve access for patients throughout their entire continuum of care. We're trying to have a more holistic and individualized approach with our availability for funding and how people use it. So we'll talk a little bit more about that, but I don't want to spend a ton of time on a slideshow. I know there's probably a lot of questions. I would rather be able to kind of get to those because I do think that some people in the Fabry community are pretty familiar with us and maybe just have some questions about changes. First things first, I want everyone to know that we are a charitable nonprofit assistance organization. So we are very similar to others that I believe you have even invited and are coming to talk to everybody, which is great. Healthwell, TAF, PAN, they all are similar to us in that we provide assistance for patients in certain disease programs. We used to have those different sections of funding separated out. So if you needed assistance with co-payment or you needed assistance with premiums, you would apply for those separately. And as we noticed that there was some decrease in funding over time, as medications stop having only a brand name and generics become available, we see a decrease sometimes in funding. And so this was a way for us to try to be more individualized in how a person can choose to spend their grant dollars. So it's the same amount of funding that you would see across those 4 different areas, but they're all combined in one, and you can use them more for what areas you personally would need them for in your financial healthcare journey. So if you are interested in looking at our different programs or to specifically look at the program that we have for Fabry, you would go to our basic website at www.accessiahealth.org and go to the financial assistance in the top left corner. And that'll take you to this page, and towards the bottom of this first section, it says patient programs or check eligibility. And you can do similar things from both options, but if you just wanted to see if you might be eligible without giving up any personal information at all, you can go to the check eligibility, and we have a pre-screen tool, so you can enter information about how many people live in your household, what your total income is just in numbers, and then what state you reside in and what type of insurance. And it'll let you know, just based on that basic information, if you appear to qualify for the program, and then you can then move into the process for applying at that point. If you already know that you're there on the website, in order to apply for a program, then you would just go straight to the patient programs, and it'll bring you here. There's two different steps. Step one is to choose which type of insurance. This can be confusing, probably one of the most confusing things that I think we see about the term public versus private. And so this just breaks that down a little bit more. Publicly insured programs are anything that is federally sponsored. So a person who's on Medicare, or even is of Medicare age, and even if they're still working, likely has Medicare Part A, even if they're not utilizing their benefits at that time, that person still falls in what we would call the publicly insured space for programs. And this is also all forms of Medicaid, state issued assistance, TRICARE, or veterans. And so the other side of that we call privately insured, but this also now includes uninsured. So patients who don't have any insurance at all can seek assistance from Accessia Health. And our big goal, of course, would be to get someone in some sort of insurance plan, because this is a very expensive condition to have, as you know, and it's a lot easier sometimes if you have some insurance to help back that up, or at least give some assistance with co-insurance. So we don't require that someone has insurance, but we would certainly offer to help someone get into insurance if they were uninsured. Program status is a little bit different. I also noticed across different types of assistance organizations. I did a joint talk just last week with another group, with someone from the Assistance Fund, and they were saying that they similarly, name their programs, but some of their variances can get confusing. So OPEN is a program that is currently funded. It is accepting applications at that time, and there's not a wait list. That doesn't mean it might not take a day or two to get through the process, but there isn't a list that you are going to just sit on and wait for an opening in the program. And then that brings me to the wait list, which is a program that is funded, does have patients actively in it, but at that moment it is currently at capacity for funding. And so at that time, patients can join the wait list. And this is where I think it's important to note, if you feel like someone is going to have a need, if you feel like you anticipate there's going to be a change, or maybe even you are getting a little bit of help with a program or with a manufacturer, but then that's going to run out and you anticipate that, we always encourage people to go ahead and get on the wait list if you feel like that there's going to be a need, because those are addressed on a first come, first served basis. We do send out notification. It is something that you opt in on when you do join the wait list. There's an option to say, yes, I want to be notified once space is available, or if new programs become open, it also notifies for that. And then seeking funding is a list of other programs that we have that we're currently seeking funding under. This is what a sample program will look like on the web page. And so if you notice where the blue coverage is lit up there, and beside it there's medications, diagnosis codes, and resources, you can click on each of those. They take you to a different tab that covers what it says on the tab. So the coverage for this particular sample program shows you what the limit is for income, the maximum assistance amount that would be available, and also you'll see down there that travel expenses limited to 500, and that's true for all of our programs. I'll talk about that just a little bit more in a moment. But our application process, you just simply need to have your own demographic information. If a provider or specialty pharmacy is wanting to apply on behalf of a patient, they can do that on our guest application right now. I do want you to be aware that we have some really exciting upgrades coming to our portal. We have those in the first phase of testing as we speak, and they look amazing. So it's about to get a lot less clunky in our processes. So looking forward to hearing how those are doing for patients and their providers. So you'll also want to understand information just about the basic details on health insurance at the beginning. And then once we get the application, we may request some supporting documentation. So we might need an insurance card to be scanned in or sent in, and those can be done easily on the website at a portal upload, or patients who apply can create and I encourage them to create a portal account if they have easy access to internet. It's real easy to communicate from within the portal. So our application process is that you apply, and you can do that by phone, on the web, or the intranet. And that's something that we haven't fully gotten set up yet, but that is coming down the pipes as well. Supplemental documentation, if any is needed based on the program. And then you'll be sent a determination of the eligibility from there. And then you'll have to make sure that you maintain your assistance. I've been with Accessia Health for about 2 years, and for the last year and a half, I travel around to a lot of patient advocacy conferences just so that I can get kind of the frontline information from the patients and their providers about how things are going. And one of the things I hear the most often is frustration at having assistance that closes due to inactivity, or certain documents that don't get sent in a timely manner. So we're definitely working to improve our processes for communication on our side, but just take that, to note as well, that if there's communication that comes and says, hey, we have eligibility coming around to be re-verified for your file, make sure you get that documentation to us in a timely manner, because of our relationship and compliance that we operate under with the Office of the Inspector General, we have to treat everyone fairly and consistently. So if we follow our practices and get all of that information out, and we don't receive documentation timely, we can't reopen patients' assistance. And I know that can be really frustrating to know that you had assistance and not be able to utilize it any longer. So these are just some different ways that you can reach out to us. I'll be certain to send back out to you all a copy of this slideshow, because on this slide, we do have just some different resources that are available that have other financial assistance available for patients with different types of diseases. Some have options for the Fabry community as well. So I just want to make sure that everyone knows those are also on our website. And this is just some words about compliance, but it is important to note that we, as I mentioned before, we do operate in a compliant framework. And sometimes that becomes frustrating for patients and providers, because we have to be careful about conversations that we have with other parties besides patients. And so we're working on making sure we do a better job at offering three-way phone calls with patients and their specialty pharmacies if there's needs that we can help with, in getting billing resolved and answering questions about assistance. Okay, and that's about it. I know I went through that pretty quickly, but as I said, I thought there might be some questions, and I wanted to make sure there was plenty of time for that.
Great. Thank you so much, Jennifer. Let's see. And can you go back to the slide with the phone number on it, please?
Yep.
Awesome. Now, that was very succinct, but here is where I encourage our primary attendees, so individuals with Fabry disease or their family members or caregivers, time to enter your questions into the chat. Okay. So first question. When does the assistance restart? Is it January 1st? For example, if you've used all of your funds for 2023, January 1st would be the restart.
That is correct. So we just finished finalizing our funding amounts for 24, and the Fabry program is remaining the same from 23. I wish I was saying it was more, and I'm going to see if we can't get a better message for 25. However, they are staying the same. So if someone is active in their assistance, those amounts will be available on January 1st.
Next question for you, Jennifer. What types of services does Accessia help with? For example, hospital visits due to Fabry, or infusions for Fabry, or?
Yeah, that's a great question. So when we say what types of services, we have 3 different categories, if you will, of spending types, if you want to break it down that way, not including travel. So we'll talk about travel in a moment, but copay, when you hear that term, is consistent with what we mean when we say to help pay for medications or treatments that are directed at treating Fabry directly. So those would be falling under copay. And then premium, it's pretty explanatory. It would help pay for a premium for a patient. We do, just to put clarity around it, we do pay for vision and dental for people who are, paying for those, like in a group setting, in their out of their pay stubs, or if they're paying quarterly and those are lumped in with those. As long as we have reimbursement, proof of premiums, and all of that, we will also cover those. So if a patient has more than one policy, then we have them select which policy they want us to help with. So they would usually choose the one that costs the most. But again, that's up to the patient to choose. And then under medical expenses, that's where kind of everything else falls. Yes, we would help with nursing for infusion, for pumps and supplies, costs that aren't normally going to be fully covered by certain plans or at all by some plans. We see patients who are still doing home infusions, but maybe the coverage isn't there, right, for them to be able to do that, but it's their choice and they are incurring some costs out of pocket for that. We can help with those. For certain communities, and specifically in the lysosomal storage community, we help pay for visits that are for labs or diagnostic testing that's directly related to any kind of concerns about advancements with the disease itself. I know that there are certain tests that they look at on a regular basis to see how infusions are doing and whether or not those are working well, right? So those things would be covered. We also cover medications that are directly related to symptom support. And so in this community, again, it's a grouping of types of medicines, but pain medicine is covered. That's all done under the medical expenses. So it's a bit of a clunky process, I say, at times, because it does require that you turn those in for reimbursement. And the reason for that, just because sometimes it's helpful to understand rationale, we have to make sure that we only pay for FDA approved and indicated treatments under our copay. And in order for us to have this other card that you can use for things like travel or infusion services or even certain durable medical equipment, we couldn't have the codes on the backside turned on for the pharmacy, because then patients could just kind of be open to buy anything that they wanted at the pharmacy counter. So unfortunately, in order for us to remain in our compliance program, we have to keep those separated. But that hopefully covers the bulk of what we will pay for, and certain durable medical equipment that help with mobility and things like that. We can't pay for upkeep, maintenance, coverage for those types of items, or even like hefty shipping, but the devices themselves, if they're considered healthcare equipment under durable medical equipment and things like that, we can help with those.
And Jennifer, a related question, I think you kind of answered. This is person saying that their husband has been on Fabrazyme since March. He's doing well, and he was told that he can do home infusions. The problem is, as we know, Medicare will not cover his home care. What does this person need to do to work on that transfer?
So if the question is work on the transfer to go to the home setting, I'm maybe missed the
Right.
first
Oh,
part.
sorry. Yeah. So what would that person reach out to Accessia Health? Would they reach out to a home nursing agency?
Right.
And how would they apply? Can they do it like proactively, or is it only after the fact?
So someone can apply for our services if they have the financial criteria met and they have Fabry. Like those are the two big pieces. And that's why I always like for people to understand that pre-screening tool, because that'll tell you whether you should join the wait list, right? You don't have to have that specific immediate need. Although once you were to be opened to apply and be accepted, you would certainly need to have something that you would be utilizing that funding for. As far as how would you transfer from being in an infusion setting to the home setting, that in and of itself is going to have to be managed by the provider. I would say that's who I would ask if it were me, just from what I've learned in this last year and a half. And anybody else on the call certainly might know better even than that. But my understanding is that your provider, whoever it is that is monitoring that, should be able to help with, okay, well, here's the next best step we would take if we were going to do this at home instead of in the infusion center, because it is a big change, because you've got pharmacy changes and home infusion nursing has to come in and get that set up and a schedule set up and who's in the area. There is a lot. I would say start at the provider and apply for Accessia whenever you think that there's going to be a need. And then we can even pay directly to providers of home care, as long as we set up, establish, they would send us what's called W-9, and then we would just establish them as a vendor, and they may already be vendors.
Okay, great. So it sounds like, Jennifer, the first thing to do is to go on the website and see if you're eligible, and then go back to your doctor and talk about making that transition. Maybe there's a case manager or other members on your care team that can help with that as well. But Accessia could help with reimbursement or front end costs in theory.
That's correct. Yes.
Cool. Okay. All right. Well, I have another question for you. Which I guess I can preface by saying that individuals with Fabry disease often need to have an MRI, sometimes of the heart or the brain, to monitor their disease progress. But it's something that coverage is plus or minus, with differing outcomes in terms of if a patient has an out-of-pocket responsibility. Is there any coverage for MRIs that directly are monitoring Fabry disease?
Yes. Yep.
Really?
That's simple. Yeah.
Can you tell me, I think that's really exciting. Can you tell me more about, would that come in the pre-authorization process? If someone is estimated to have a large out-of-pocket cost, they would just check the eligibility?
Yeah, I mean, it would depend on what kind of out-of-pocket costs, no reason not to be fully transparent. I think it's available on the website for Fabry. It's $4,500. I'm pretty sure that's what it was for the year. And so the way that works is, say it's January 1st and I'm going to go next week and see my doctor, and we're talking about the MRI. We're dating about it, and I'm finding out how much it's going to cost. And they come back and say, my out-of-pocket's going to be $2,200 to have this test done, and I have to pay it up front, right? They're not going to just let me get the test and pay, over time, or maybe they will. That could be paid for directly at the hospital using our spending card, because all hospitals and healthcare providers' offices, at least everyone I've met so far, are on our list of acceptable providers. Now, I say that because we do audits. So if a large amount came through, what might happen is it would get flagged, and we would just then maybe reach out to the patient and audit a file depending on the different parameters that they choose for auditing. And we would just want to make sure that we saw that that was related. But we now are trying to take the patients out of having to contact their physician all the time. And so if anybody has questions in the clinical area, I usually review those claims myself, and I've talked to doctors directly just to get things sorted out and save the patient time from having to get letters and send them in.
Jennifer, just to make sure I understand it. So when you're talking about something like an MRI, does that come out of the medical assistance category?
That's how it would be labeled. It doesn't really impact you as a patient where it comes from. Meaning, if you have $4,500 and you have an MRI that costs $4,500 exactly, you could put that on the card. You would have no more money left for the year.
Okay.
The only thing you can't do that with is travel. If you went to the gas station, you can only get so much gas. And so I think the way we're trying to make sure we spell out travel now is it's to help with ground travel. So hotels even we would pay for, but $500 isn't going to get you too far, but it might get you to a clinic once a year. It does pay for parking. But at $500, those codes that go all along with travel are shut off.
Okay. So I have another question.
Yeah.
So if you're talking, the medical assistance category does not cover the medication itself, like one of the three Fabry specific treatments, like Fabrazyme or Elfabry or Galafold.
That goes through the PBM card almost always because of the cost. Now, every so often, I've had somebody who's on a specialty med that had to pay something out of pocket and then get reimbursement for it, but that's not usual or typical. The PBM card is where we would prefer, and I'm sure PBMs and specialty pharmacies and patients alike would all probably prefer that it just pass through that way because it's just so costly. But you're right, it doesn't fall under the medical expenses. It's called a copay on the back side. But if you, again, it's January 1 and you go to get an infusion and you have a big deductible to meet out of pocket and you have to pay full price for that first infusion, then.
Well, that's what I was leading to. So to finish that question is, what I imagine is that infusions themselves or Galafold are covered under your insurance, and that's where your insurance premium assistance program comes in. Is that right?
Yes.
So it's covered with your insurance premium assistance, and then if there's a copay, that might help further. Am I thinking straight?
So you can use your funding towards your premium payments. And if your premium payment is only $100 a month, then whatever you have left over in a year, you can use on copayment, or you can use on your infusion out of pockets because your copay is covered entirely. Or it's a lot of ors. It's a lot of patients get to choose.
But I think the whole idea of infusion or the Galafold cost itself is really covered by the primary insurance program, with the ability to have a secondary insurance program and used under the insurance premium assistance. Okay, thank you.
Yeah. Mm-hmm.
Okay, thanks. A couple more questions.
Yeah.
Along those lines, my geneticist recommends that I see a specialist, a GI doctor. Is there something Accessia could help cover?
So I have to say that when we start to look at things that fall outside of your typical symptom management, it's case by case. We often do cover if there's a specialist that's being seen, especially in cardiology. We know that with all of the lysosomals, there are things that go on even with swallowing that most people don't think about or recognize as being an issue early on. So I'm not saying no, but I don't want to just give a blanket statement. I'd say that those are cases that they should probably just reach out individually, but we'll ask for, I'm sure, some collaboration between their primary, Fabry doctor and whomever it is that they're referring out to.
And the next question is about someone who was admitted to the hospital for 5 nights because of symptoms directly related to Fabry disease. Is that hospital say something that Accessia would be able to provide funding for?
Yes, we could help pay for that. Again, I think that there would be a request for documentation from the hospitalization, and but yes, yeah.
Let's see, other questions that we have been asked at other webinars. For your health insurance premiums, if there's a family plan and one individual has a Fabry disease, how is that reimbursed?
We pay for the full premium.
The full premium, okay.
I'm assuming that's what the question is. Yeah.
Right, or if it's 1/5 if it's a 5-person family. No. Okay. And then I think you covered this one, but just to be sure, we talked about travel, possibly going to see like your genetic specialist or getting a diagnosis, or travel to infusions. What about travel to see specialists? Is that case by case as well?
So I think travel gets a little bit tricky because I think that, the concern is, well, what if I didn't fill up my gas tank on the exact same day that I went to see a provider? I think that what's important to say here is that, we hope that no one is going to take advantage of this type of charitable help, but we recognize that sometimes that could happen. Really, I think it's important to understand that we understand that you might need to go to the doctor today and you didn't plan that and you filled up your tank yesterday, so we suggest that people use the fuel benefit as they need it for fuel. And if we request documentation, that we get documentation that shows a tank of gas and not, groceries from inside. So it's that sort of thing. I can't say that someone is going to lose assistance because they didn't go to the doctor on the same day that they went and put some gas in their car. That being said, if we're paying for parking, we're going to want to see that there was a doctor's visit associated with that, or a hotel stay, that there was a linked visit with a specialty clinic. So it was a long answer, but ultimately we help pay for people to have transportation, and sometimes that need might happen on a different day. But people should be using it for fuel and not things that you can buy inside the gas station, or
of course. Yeah. Okay. Are there any other frequently asked questions that you get?
Oh, so I have to be honest, I know I'm sharing my screen and I see 13 on the little chat box and I can't see any of the questions. So I feel like did I get everybody covered? Do you feel like everything answered?
I think so, but please,
Okay.
Jerry, or participants, chime in if I have missed something.
Well, and I'm trying to think of frequently asked questions too. I think one of the big things that came up when Stephanie and I were doing a presentation together, which was Taff and I, was the difference in the enrollment. Because I know that January 1st is coming and a lot of people are saying, well, I applied last year, or they get confused because there's 6 of us, right? And if you don't have any help and you have, financial need, people might be on a couple waiting lists trying to figure out like where they're going to get help from next year, because we know how expensive this can be. So a big question we get asked is, how do I know if I'm still on the wait list? And so you can always go online and just sign up for our portal. You can call, but we are a smaller team right now, especially with the holidays. So sometimes there's a wait time, but actually we even have a system where you can use like self-service and put in your own identification to check on the status. of your application. You can do that through our phone service without talking to a person. But if you're on the wait list, you're going to stay on the wait list. It doesn't get cleaned out. It doesn't end because we aren't closing our assistants out like other programs have new enrollment every single year. So that's a difference that I do hear people asking about. So those are ways you can check on your waitlist status if you are waitlisted.
Okay. Are we ready for the prize drawings, Casey?
I suppose we are. Well, Jennifer, thank you so much for coming to talk to us today. We recorded this and we'll work on getting it posted to our YouTube page. I should say our last 2 webinars have now been posted. So if you missed the last 2 or you have questions about some of those other acronyms Jennifer was saying, you can find those on our YouTube. But thank you so much, Jennifer, for joining us. We are going to pivot and we are going to talk about some prize drawings.
Okay,
Yes,
have a great rest of your night.